we have to hook up the circulation with microsurgery, and that involves sutures that are as fine as human hair.
Is this something that we should be doing on such young persons, changing their whole shape of their eye? Some of the most attractive models are doing it.
I think this is a minor version of changing gender.
You might have called the Brazilian butt lift one of the more riskier procedures in plastic surgery, right?
The risky.
People don't know what they don't know. So if you're not really familiar with all the technique and the anatomy, you can get into some danger. And fortunately, people have died from that.
The margin for error is millimeters. So if you have the free flap we were just talking about, and you got to put blood vessels together under the microscope, there's no room for failure.
Tell me your transition. I think a lot of med students and young doctors, also want to know about that.
You can see things that they're not right. They're good, but to make them great, you got to do a little bit more.
Hi, everyone. Welcome back to Give Good Face, the podcast where we talk about all things aesthetic, beauty, medicine. And today I'm super fortunate and honored to actually have Dr. David Hidalgo here of New York City. He's a world famous plastic surgeon. He was the chair of plastic surgery at Memorial Sloan Kettering, where I work. His name is still talked about in so many arenas, not only for his amazing surgical skills, but also his skills as an artist. So Dr. Hidalgo, thank you so much for being here.
Anthony, a pleasure to be here.
Yeah,
Thank
I'm
you.
super excited because, I work at Memorial and everyone talks about how amazing you are. The scrub techs, the nurses, they all say like how great of a surgeon and how great it was to watch you operate. And now you've been in practice for over a decade, right?
Over 20 years.
20 years
Yeah.
in private practice on Park Avenue.
Mm-hmm.
You've seen your focus shift, I would say. At Memorial, it was definitely a lot of reconstruction for cancer.
Yes.
And now you're more in the aesthetic space.
Yes.
But the two blend.
They do. Memorial was more hardcore reconstruction. And I was there at a time where we had a lot of independence and the institution was very supportive and we innovated a lot. And we did some breakthrough work that's still is a standard of care around the world today. For example, in jaw reconstruction with microsurgery.
You did the first fibula?
The first fibula free flap mandible reconstruction.
Wow.
So I was like, 6 months out of my fellowship.
Oh, wow.
And it was a daunting situation because I'm at, the most famous cancer institution in the world. But the tools we had at that time weren't very good. And what I simply did something that we did for trauma, adapted it to cancer reconstruction. And it was a moment where there was that opportunity to do that with a supportive institution. We took the leap and it was, we really moved the field forward and transformed the lives of thousands and worldwide now, who can say how many, but it was a big leap in reconstruction. So those were the good old days for me.
I mean, the free flap is, amazing procedure. It has helped so many people. I see so many people after reconstruction. And it, to pioneer that, it has to take a lot of guts.
Well, just for our audience to understand what Dr. Rossi means by free flap is we can go to a different part of the body and harvest the tissue that we want, whether it's bone, muscle, skin, and take that as a block, not simply as like a skin graft, and move it to the part of the body we want it. But we have to hook up the circulation with microsurgery, and that involves sutures that are as fine as human hair, and it's done under a microscope, and we give circulation back to that tissue, and once it's there and living again, we can shape it into what we want. So free flap surgery was a tremendous advance over what had come before. And we learned how to mine different parts of the body for different types of tissue that we wanted. So it was an amazing opportunity to move the field forward back in the day. But again, the institution was very supportive, and my colleagues were very supportive because they knew that the tools that we had weren't cutting it. They weren't that good. And so we were welcomed with open arms, and we did some good.
Yeah, and that innovation, we don't always see it in medicine, but there's periodic times when like innovation happens and then, it takes over. And you were at Memorial for a pretty good amount of time.
About 14 years.
14 years. And then tell me your transition. I think a lot of med students and young doctors also want to know about that, because I think that's a big step forward as well.
Yeah, and what you're saying before in terms of it taking a lot of courage to do one of these things for the first time, it's true. You feel very lonely in those situations, but you know that what we have is not good enough, and this may make things better. So that gets you over the hump, and you
Mhm.
actually do, and it works out well. But as far as shaping a career and transition, Memorial was great for me at the time because when you come out of training in plastic surgery, you're like a soldier, and maybe not a great analogy, but a soldier wants to go to war and really get into it and learn how to do things. And Memorial was like that for me, and you got to use all your skills and develop things. So it was very foundational for me as a plastic surgeon to do the big things. But for me, plastic surgery is a continuum, and it's not just the hardcore stuff. But as you know, it's all based on aesthetics, and aesthetics is how we see things and how we want things to look. So we focus on shape and form, and whether it's reconstruction or cosmetic surgery, the principles are the same, but we're just doing something a little bit different. So to me, morphing from reconstruction to cosmetic surgery wasn't a big leap, and I made it as a gradual transition. You can't close the door one day on doing reconstruction, next day be a cosmetic surgeon. You have to sort of transition over a period of years, which is what I did. But it was very challenging to make that change. And if you do it in steps incrementally, you can do it. And the nice thing about plastic surgery is that since we cover head to toe literally in the procedures that we do, you can focus on whatever it is that appeals to you. And moreover, plastic surgery careers are long enough that not that you get tired of something, but if you want to explore another area, you can sort of morph your practice into something that perhaps holds more interest to you at a particular moment in time.
That's great advice. And the idea that form follows function or vice versa, is really important in what you do, because even if something's just for aesthetics or the patient thinks it's for aesthetics, there's really a function involved as well, and you need to respect that.
Yes, and I would say reconstruction and aesthetic surgeries alike in other ways, meaning the margin for error is millimeters.
Mhm.
So if you have the free flap we were just talking about, and you got to put blood vessels together under the microscope, there's no room for failure, and 1 millimeter makes a big difference. But similarly, if you have a 16-year-old with a bump on their nose, it's conceptually simple that okay, just take the bump away, but it has to be done with such precision that there are no imperfections because that operation has to last that person, what, 70, 80 years if they do it when they're 16? Though conceptually simple, it is exceedingly demanding as much as a free flap.
Yeah.
And the consequences are not as well, they're as immediate and long term as a reconstruction. So to me, there's not much difference. The focus is a little bit different, but the things that are important are the same.
I love your ethos about how meticulous you are. And people have
Yeah.
said that about you, how meticulous your surgeries are, which is wonderful to hear, because every millimeter counts.
It does, and you have to be more than fastidious and meticulous. You have to be unforgiving in terms of the pursuit of perfection. And some of the things where you pay a price for that is with the clock. What do I mean by that? You designate a certain period of time to perform a surgery. And for me, like if we consider like a revision procedure on somebody who had surgery elsewhere, was a problem, and you're trying to fix it, and you say, okay, this is going to take me 3 hours, and you get into it, and you're 4 hours into it, 5 hours into it, it's still not right, but you know you can get it right, whatever it takes to get it done. And you pay a price because you have a regular schedule that's shot to
Yeah,
what.
yeah.
It's your family where you're supposed to be at dinner or whatever. So you don't pay attention to the clock. The goal is paramount,
Mhm.
and it's things like that are important if you want to be. It's not just trying to be the very best. If you want to do the right thing by the patient.
Yeah. Patient first always, which is really important because, as you know, we're seeing this boom in plastic surgery, I feel like. And you must feel it as well. Not and we could say it's driven by social media or, sort of everything that we're seeing around us, reality TV. How do you feel the mindset around plastic surgery is. Are you happy that it's much more of a global acceptance, and it's more talked about, or
Yeah, well, to your point, I think it's always been very popular. It just hasn't been above board.
Mhm.
People wouldn't talk about it, but people, at least between themselves, they would say, if you want this, go see this person, go
Yeah.
see that person. So there was like a network, an underground.
Yeah. Especially in New York.
Yeah, and the focus was not like social media today, which is instantaneous in everywhere at every place. Back in the day, it was through like the Condé Nast publications, Vogue. You get a write up in Vogue, and all of a sudden your office would be flooded with calls. So I think today it's more omnipresent, it's more instantaneous due to social media. There's a lot less inhibition about revealing things like Kylie Jenner and Alix Earle just kind of
Yeah.
recently fessed up about what they did with specifics to themselves. So I think it's more acceptable. It's more sought after. Again, I think omnipresent is the word.
Yeah, Alex was very transparent and told everyone, what you did with, for her, which is amazing.
Mhm.
I think to have that level of transparency is great, especially in plastic surgery. Do you think it's influencing body positivity, or how do you think it's influencing the idea of body dysmorphia, or do you
I
see that
yeah.
on the rise, or?
Well, I think on the one hand, if somebody, most people just have like one thing that bothers them,
Mhm.
and so those are good patients because they're realistic, goal oriented, and they don't have any body dysmorphia. So for them, they can go on social media and search and get a ton of information about whether it's a Brazilian butt lift, a breast augmentation, whatever. They can educate themselves and they become a better consumer. At the same time, I think, there's a lot of people, just like social media in general, it's not helpful because they see things and everything looks better on the other person's lawn. The grass is always greener,
Yeah.
sort of thing. And so, it can be problematic, I think, for many people. It just depends on your own state of mind and how confident you are in your own skin.
Yeah. Well said. I mean, well said, because we want to help the patient along it. But if they don't have realistic expectations, like, we also have to help them along with that as well. And I think sometimes what people are seeing, whether it's filtered or, they're using apps to change the
Right.
shape of their body or the shape of their face, this can be very misleading for people. And
Yeah.
so not everyone looks like that in real life.
Hmm.
And, how do you tell them that this is what it'll look like, but it's not going to look like what you see on social?
Yeah. It's interesting. I don't find that social media creates artificial trends, meaning like everybody wants big implants
Yeah.
or little implants or whatever, right? Most patients are very, again, realistic and they say, I don't like this. What can we do about it? So, on the whole, as far as social media goes, I think it's more helpful than
Nice.
harmful.
Yeah. And speaking of social media, there's a lot of trending procedures
Yes.
lately. So, like, the deep plane facelift,
Yeah.
such a hot topic, even though it's been around for quite some time.
Yeah.
How do you feel about that? I know you've educated your social media, which you have a great social media. You educate about the different types of facelifts.
Yeah. It depends on how deep you want to get into the weeds on this,
Yeah.
because I could go for an hour
Yeah, I
on
know.
deep plane, but it's something I think is more a triumph of marketing over what the technique differences are. Basically, we're talking about facelifts, and we're talking about how you handle. There's the face is like an onion, different layers, and skin, fat, and then there's a layer called SMAS, SMAS. It's an acronym for an anatomical term, which is neither here nor there. We call it SMAS. And so deep plane means that you go under the skin, you go under the SMAS, you release all the ligaments in the face, and then you tighten everything and you maintain the shape by tightening the SMAS. All plastic surgeons do that. And the differences between a SMAS facelift and a deep plane facelift are really subtle to the average person. But in a nutshell, I don't like deep plane because, as I just mentioned, they lift the skin and the SMAS together and move it. So you can only move it in one direction.
Hmm.
A SMAS facelift separates skin and SMAS so that you optimally can move SMAS vertically, which gives you the most powerful facial reshaping, and then the skin obliquely, so you don't get any artificial shape. Deep plane, what I don't like about it is when you raise them together, you get a big wad of skin here, and then you have to carry the skin in front, and it just doesn't look good.
Mm-hmm.
So there's nothing wrong with deep plane facelifts, and many do it beautifully. Similarly for SMAS facelifts, but I think people get hung up in deep plane. It was originally started by plastic surgeons back in the 90s, and traditional plastic surgeons, ultimately rejected it because we didn't like what it was doing. It was releasing too much, too
Mm-hmm.
much. You lost control over facial shaping. And then the next school of plastic surgeons, facial plastic surgeons, who came out of ENT programs, they latched on to deep plane, and they very aggressive marketing. They popularized it. So now a patient feels if they're not getting deep plane, they're not getting the right operation. So it's interesting, but again, these are subtleties.
Yeah. So you heard it here first from the master. It's not just a one size fits all, right? Like you really need to look at the patient, how they
Yeah,
move.
yeah. And you know what, Anthony, that's a very good point, because if you do deep plane, you're doing the same operation on every patient.
Mm-hmm.
And facial anatomy, as you know, is so different from one person to another. When we do SMAS facelifts, we can decide how much we want to lift the SMAS, how we want to tighten it. Deep plane is like, one size fits all.
Mm-hmm.
So that's an important point.
No, that's great. And I think it's important for people to hear this, to get this out there in content because, people do get hung up on certain procedures. And one thing that was trending for a while, and maybe it's gone down now, is this like foxy eye,
Mm,
canthal tilt,
yeah,
endoscopic brow lift that
yeah,
we see. And we're seeing it in younger and younger people.
yeah.
And, is this something that we should be doing on such young persons, changing their whole, shape of their eye to lift it up? Some of the most attractive models are doing it.
Yeah, I think this is a minor version of changing gender. Just doing these specific things to the face. And to your point, they're all trendy.
Yeah.
They're not natural.
Hmm.
They're not going to pass the test of time. So the eyelid thing that you just described, nobody's going to be doing that in 5 years. I
Yeah.
mean, social media can make it popular, and certain people. I mean, there are people who think Cybertrucks are beautiful and they buy them. So there are people who are going to think these eyelids look great
Yeah.
and they're going to do them. But again, I don't think it will withstand the test of time. And endoscopic brow lifts, again, endoscopic brow lift is a way of lifting the forehead through tiny incisions. And I did that for 10 years, and the problem is they don't last.
Hmm.
So as far as brow lifts go, there are very few people who need their foreheads lifted. But those that do, if they really need it, the traditional brow lift, which, this sounds like gory, you have to make an incision all the way across and lift the whole forehead up. Those work.
Yeah.
So if you use those on the right patient, you're not going to be doing it very often, but those work
And they last.
and they last.
Yeah, which is
It's
great.
one and done.
Yeah. Speaking of, I was recently in Korea for my skincare line, and I spent some time with surgeons there and dermatologists, and they're doing some radical facial reshaping,
Yeah.
and really to the point of almost things are becoming very homogenous in the sense,
Hmm.
like they're doing again a very similar technique on many different faces, and the faces are sort of becoming very similar.
Yeah.
And I think we need to respect individuality as well,
Yeah.
to some extent.
Yeah. I think Western plastic surgery is quite different than what
Hmm.
you saw there.
Yeah.
And the facial structures are different, and they focus on different things. They focus on making a wide jaw more narrow by
Yeah.
taking out the corners
Hmm.
and doing things like that. So it's a totally different population. It's a totally different aesthetic. It's a totally different side of plastic surgery that is valid, as you saw when you were there, more popular than ever.
Yeah.
So it's interesting that there's different geographical types of plastic surgery,
Hmm.
more so now than ever.
Yeah. And we're seeing more and more of that because of the spread of information and social media, which
Yes.
is, I think interesting for people to watch. I mean, the content is being eaten up.
Yes,
Yeah.
for sure. But there's also a safety element.
Yes.
I think outside of the U.S., it's easier to do things that are more avant-garde and aggressive
Hmm.
than it is here. And we've seen like the Brazilian butt lift that got so popular. If there's no oversight, for example, in Florida, where there were clinics set up, it was very fly by night type of situations. There were a number of patient deaths
Yeah.
because that procedure has some intrinsic dangers that if you are aware and you practice properly, that won't happen. So I think, oversight is important, and we have that here in the U.S. Other countries, they do, certainly Europe, but other areas, I'm not so sure. So there's a lot of things being done that I'm not sure are safe.
And correct me if I'm wrong, you might have called the Brazilian butt lift like one of the more riskier procedures in plastic surgery, right?
The
The
riskiest,
riskiest. Yeah.
the
I
riskiest.
remember you saying that. And it's unfortunate because people don't know what they don't know. So if you're not really familiar with all the technique and the anatomy, you can get into some danger. And unfortunately, people have died from that. Yeah.
Yeah, it's a very hazardous
Yeah.
procedure.
And I don't know how long that aesthetic will last for as well.
I
But
agree.
that's an opinion piece.
And to add to that,
Yeah.
I don't know how well those procedures age.
Yes, for
So
sure.
if you have somebody in their 20s with tight skin and they look
Yeah.
great,
Yeah.
and then in their 40s, not sure what that's going to turn into.
Yeah.
Equally important, you can't reverse these things.
No.
You can put fat in, but you can't take it out and end up where you started originally.
It's
That's just
very difficult.
not going to happen.
Yeah. One thing I so admire about you is your artistic ability, both not only surgically, but your artistic drawing.
hmm
And you have these hyper realistic drawings. When did you start that? And when did you like know that you could actually do that?
Well, I think for me, art came first.
Oh, okay.
Yeah. And when I was in college, I had to decide, do you want to go into art or medicine? And I
So that
came,
was a cross
yeah, it
for
was
you.
a big crossroads. So I came up to Soho and sort of try to see what it would be like to have a loft. And I decided that a career in art, you can be doing the best art in the world, but if you're not doing what's either popular or marketable, you can spend your whole life doing something for yourself
Hmm.
and nobody else gets to see it or benefit from it. So I went into medicine instead, but art has always been a part of what I do. And furthermore, I think art is, for me, is inseparable from surgery
Yeah.
because surgery, plastic surgery is all about seeing, and so is art. And so one complements the other. And I would say art helps surgery far more than surgery helps art. Although that sense of time doesn't matter, you can get lost in a drawing for 6 hours, and that's fine. So maybe that carries over that way. But more importantly, appreciation of shape and form translates into surgery because there are times when, like, we're doing breast surgery and I'm sitting there, and I'm sort of like, we're like 3 hours into it and everybody's looking around like, it's done. What's he doing?
Yeah.
Because you can see things that they're not right. They're not quite there. They're good, but to make them great, you got to do a little bit more. And so for me, art has been invaluable in making me a better plastic
Yeah.
surgeon. Specifically for those drawings. Those drawings for me are a lot like surgery because it's like building blocks. You're not just getting immediate gratification from doing a 2-hour drawing. These drawings, they take a year.
Yeah. I saw that.
So, 300 hours, 500 hours, and you can't do it full time because you got a day job.
Yeah.
These are your, what do they call it? The 5 to 9 job.
Yeah.
So you just kind of chip away at it. It's like building a house. You work at it, you don't see much, but 3 months later, you see a foundation, it's framed, and a year later, it's finished, and you got something to look at in terms of the process. But it's also a form of meditation because, I can sit there and I can work on, a piece of the drawing that's this big for a couple of hours, and your brain is just free. You have music going, but you think all kinds of things. You think about what you're doing in plastic surgery. You think about everything around you, but you're focused and you're working on something. And the other thing I like about drawing is you can pursue perfection with no risk. I mean, in surgery, yeah, you can't work on somebody for 9 hours.
Yeah.
At some point, you got to say, okay, this is great, we're done. But in drawing, you're not. For me, you're not getting paid for it, and nothing matters except what you're doing. So you can put 100% of effort into it and make it perfect as far as your intent and as far as your vision of what that drawing should be.
Yeah, I mean, I think it's an amazing feat of what you accomplish with these drawings, and inspirational too, to see like the finished product of that, but to see also your process is
Yeah.
really unique. And
Yeah, well, I didn't originate this. The guy who did was Chuck Close back in the
yeah,
'70s with his big airbrushed facial portraits that are 12 feet high. If you ever see those, there's one in Chicago Institute, and they're here and there. It just blows you away. So he started it, and present day Robert Longo is the
hmm,
master.
I met
So
him.
did you? Yeah,
Yeah,
I met him
yeah.
too. I went to his studio.
Oh,
Nice
nice.
guy. His technique. I mean, he has more of a factory. He's got a lot of people doing these things.
Yes.
I can't delegate it. But to me, while he is the master of that type of drawing today, I feel a little bit differently because he can render an image that no one else can. But a picture has to have soul. It has to have a message. It has to be more than just the image. The viewer has to sort of get into it. And if there's two figures in there, ponder what's going on between these two figures. So you can't just like do a car perfect and
Yeah.
it looks like a photograph. I mean, to me, that has no weight or
Hmm.
value. So my drawings, there has to be a message, a soul. It has to be about the human condition. It has to be something, regardless of the subject matter, that everybody can instantly get into it and identify and say, wow, what's going on, and it's more interesting that way.
Yeah, I've seen your photos on the soldiers or
Yeah.
like the athletes, the track runners, and
Yes.
you see the emotion in it, which
Yes.
is, or you feel it,
Yeah.
and the use of like light and shadows, or it's
Yeah.
breathtaking.
Yeah. That's the supporting cast.
Yeah,
The image, but the main draw is what's going on and what the image actually is.
nice. And so much of the aesthetic plastic surgery is about light and shadows and how, especially with the face, like how light reflects from your face, and
Yeah.
it's super important.
Yeah. It's all about shape and nuance for
Yeah.
sure.
What you think about when you draw, is it the same thing that you think about during surgery, or in surgery you're thinking just about the surgery itself?
Well, both are technique dependent heavily,
Mhm.
and both I've been doing so long, I don't need to think about that part. So in both, I'm thinking about the problem. What's the problem, and how do we get to the solution? And the differences between the patients bleed and drawings don't is how you get there, and the route you take to sort of fix the problem that you're trying to fix.
Very nice. Do you have advice for, people who are thinking about plastic surgery? I feel like you've mentored a lot of people.
I think it's like, I would say it's the same as anyone who wants to be a professional golfer or actor or whatever. You have to be intense and all in.
Mhm.
Training programs today are, we always think that we had it hardest, but back in the day we'd work 110-hour weeks as residents, and they don't do that today. And I'm not saying that's a good thing, although, just to digress for a moment, the clock becomes meaningless when you see something over a 24-hour period and you understand how the disease works and all of that. So I think, critically, you have to be intense and all in. You got to get the best training. Again, I think today's programs are a little bit watered down, maybe like the colleges, I don't know, but and you have to seek out the best teachers, because if you have A mentors, there's a good chance you'll be an A plastic surgeon. And similarly, if it's a B or C, you're not going to go beyond them.
Yeah.
So it's all about ambition, energy, intensity, and seeking out the best and wanting to be the best.
We can talk about the pursuit of perfection, but really, optimizing, how much you can get it from your residency program, or seeking out mentors that can help you along the way. I think it's important not only in medicine but in life. Yeah,
100%.
yeah, for sure. Do you feel that we'll see different trends going on in plastic surgery now, or do you feel like we're gonna see more of the same coming out? Do you have any predictions for the future?
Well, I think that the plastic surgery will continue to evolve. I don't know if we're going to see revolutionary changes. We've
Hmm.
seen them. For example, back in the '80s when liposuction came into being, that was revolutionary,
Hmm.
and I think that will happen from time to time, but they're pretty spaced far apart. Today, we're into nuance and perfecting techniques, and I think techniques will evolve slowly. So there will be continued progress.
Yeah, I mean, it's an exciting time, especially with the idea of regenerative medicine, like helping our body regenerate, stem cells
Yeah.
or, waking up senescent cells. We're talking a lot about that in dermatology as well. How certain lasers sort of turn on the genetic switch
Hmm.
of getting these cells to become more active,
Yeah.
in a controlled way,
Right.
and I find that very fascinating.
Yeah, I think your specialty will focus more on just that, turning on different genes, turning them on and off.
Yeah.
Plastic surgery is more about technique. You got an existing thing and you're trying to make it better.
Yeah.
So I think the things that you're doing in dermatology will have more far-reaching implications in terms of taking care of our skin and being healthier. And plastic surgery won't do that. Plastic
Mhm.
surgery is just about altering the here and now to something else.
Yeah. And are you a big fan? So there's been a debate, especially on social media, about, fillers and, using fillers to
Mhm.
help restore volume. There are some more biostimulatory fillers versus more hyaluronic acid based fillers. And how does that affect your procedures, such as a facelift?
Well, I think that these are strong non-surgical tools that can go pretty far.
Hmm.
But I think what I see is that a lot of patients don't know where the boundaries are,
Ah, interesting.
and they're trying to push that technique to do things it's not going to do.
Hmm.
For example, the concept that if you put enough filler here, you're going to lift the jowl.
Yeah.
Is that's not going to happen, and,
Yeah.
and you've seen it.
Yeah.
The faces start to look different and not in a good way.
Hmm.
So I think it's as far as that goes, it's recognizing the boundaries of the different tools
Yeah.
and how far they can carry you, and then realize, okay, that's as good as we're going to get. We want to do something different or more aggressive. We got to switch to a surgical option.
Yeah, I think that's so important to understand. If you go to someone who's reputable and who's very well educated, understands the boundaries of what their procedures can and cannot do, they'll guide you into the right direction. Like, you're a surgical candidate. You should go and consult for surgery.
Exactly.
Yeah, over, just adding more and more filler.
Exactly.
Yeah. Sometimes I don't say it's not the product's fault, it's the person's fault.
Right.
The person's who's doing it.
Well, and if patients become loyal and they trust you and they want you to keep going farther
Yeah,
and farther,
totally. Yeah.
and so it's our responsibility to say this is as far as we can go.
Mhm. And, someone actually asked me to ask you about, the trend of using fat, not only in facial filling, but also in body sculpting. Now, we talked a little bit about the Brazilian butt lift, but there's a lot of fat being used in other parts of the body, like
Yeah.
fat transfers for abdominal etching or,
Yeah.
you know, shoulder width.
Hmm.
And this is more sort of radical, I would say. But do you have any feelings or opinions on that?
I do, and I run a little contrary to what the mainstream
We love
feels. Yeah.
that.
So earlier we talked about microsurgery and
Mhm.
reattaching the circulation so that the whole tissue lives. That's dependable, but fat grafts are not,
Yeah.
because as our viewers probably know, when you do a fat graft, you're taking fat out of the body, no circulation. You're putting it back in, and you're not giving it new circulation. So it depends on osmosis and trying to pick up a new circulation before it dies.
Mhm.
So by definition, it's unreliable, and there are certain parts of the body where it works better than others. You mentioned muscle etching. There are plastic surgeons in Colombia, the country, who are putting fat into muscle to accentuate the six pack.
Mhm.
So fat does well in muscle because it's a robust circulation. It doesn't do well in the mobile parts of the face where you talk, you move. The environment's always moving. The fat needs something that's quiet where it can try to pick up circulation before it dies. So in the face, it doesn't work for nasolabial folds. It doesn't work for the prejowl sulcus.
Mhm.
However, it works on the cheeks that don't move as much.
Yeah.
So if I have a much older patient who's got no fat in their face, they need that. It works for that. There are some of my colleagues who use it to sort of more cleavage for the breasts. I haven't seen it work very well in the chest area. And I have lots of patients who say, it was great for 6 months and it went away. And
Yeah.
that's the typical story. You probably remember that not long ago, maybe 10 or 15 years now, We try to do breast augmentation with fat alone.
Hmm.
So you'd pump this ton of fat into the breast. Most of it would go away. End of day, patients got a little bit of augmentation, but it never was enough that technique survived. So I have very mixed feelings about fat grafting because it's unreliable. You can't count on it.
Yeah. And, if you don't know how much it will take, how much you actually put in to get the end result that you want.
Yeah, and sometimes that's self-defeating because you try to put more so that more survives,
Yeah.
but you're jamming those fat cells into an area where there's no circulation, and the whole center of it doesn't make it.
Yeah.
So what have you accomplished?
And I think we've seen in the public, a lot of celebrities who have undergone these procedures, and have looked kind of wonky for a period of time,
Yeah.
you know.
Yeah, I think though, Anthony, I think those are more filler issues as
Mhm.
you've seen,
Yeah.
and than fat grafting. So fat grafting is still kind of unknown to the general public, and they rely on their plastic surgeon, dermatologist to advise them.
Yeah.
Is this a good idea or not a good idea?
Yeah.
And in the specialty, we have zealots who think it's good for everything,
Mhm.
and I just am more middle ground and more skeptical because it's inherently an unreliable technique.
Thank you for that opinion. That's good.
Yeah.
I like the honesty. It's
No,
great.
listen.
Yeah.
You don't want to do something that
Yeah.
doesn't work because eventually folks find out.
Yeah, for sure. And speaking of, how do you maintain longevity in a field like plastic surgery?
What do you mean?
In the sense that, have you always, stayed the same course, or do you feel, I know you adapted between memorial and then private
Oh,
practice, but it's sometimes easy to jump on trends and bandwagons. How do you stay your course? Have you always been someone who's, true to themselves?
well, for me, training in plastic surgery, when I trained at NYU back in the day, we had A-plus surgeons in each subdivision of whether it's craniofacial
Mhm.
surgery, hand surgery, microsurgery. I was fortunate and I learned from the very best. And I learned how to do all the different procedures and be competent so that I could do all of them.
Yeah.
We were talking about this earlier, you can morph your practice for a different emphasis, but if you don't know how to do that procedure, you don't have confidence in it, you're not going to want to go there,
Mhm.
or you're going to have a learning curve that may take a while, and there's going to be some cost, just by definition of what a learning curve is. We have the luxury of moving around and not being locked into, like, if you're a kidney doctor, you're just doing kidneys, you're not doing anything else.
Yeah.
So we're very fortunate in that regard.
Staying locked in to the procedure or to the art form is huge.
Yeah.
Yeah.
And it brings up another issue with respect to that. Today, most plastic surgeons feel like they have to super subspecialize.
Mhm.
And then the current trend in young plastic surgeons is to market that to death on social media. So the word out there is, if you want a tummy tuck, you go to this person. You
Yeah.
want a rhinoplasty, you go to that person. And it's a successful approach, but long term for the plastic surgeon, you're just doing one thing for your whole career. And if it happens to be something that's very labor intensive, like tummy tucks, believe it or not, very labor intensive.
Yeah.
In your 30s, that's fine. 20 years later,
It's a lot
maybe
of
not.
work. Yeah.
Yeah. So you have to be careful in what you wish for, as in all things.
That's great advice, I think, for
Yeah.
anyone, who's just starting out,
Yeah.
And also, if you maintain a good breadth of surgical expertise, then you can do a lot,
For
later
sure.
on, especially, if there's, issues down the line and such like that.
Yeah, and I think also one subspecialty area complements the other. So if I do a lot of breast surgery, you're used to seeing things, and believe it or not, in facial surgery, some of those principles translate into what you're doing there.
Mhm.
So again, it's like being the well-trained artist, if you
Yeah.
will. If you've got all the tools and you can see correctly, it applies to anything you're doing.
Yeah, I love seeing your before and afters on social media. I think the beauty and the subtlety is so refined,
Yeah.
and, you know, a true hallmark is, like, you're not really sure what was done, but something was done very well,
Yes.
which I think is such a nice art form. Yeah.
Yes, indeed.
It's beautiful to see.
Thank you.
Thank you so much for being here. Yeah.
Oh, a pleasure.
This is a legendary interview.
No, I'm flattered that you asked. Thank
No,
you so
I'm
much.
very excited to have you on, and I encourage everyone to see Dr. Hidalgo's Instagram, social media. It's beautiful. It's art.
Thank you. Thank
Thanks
you,
so
Anthony.
much.
My pleasure.
Thanks so much for listening to this episode of Give Good Face. I'm so grateful for all your support throughout the launch of this podcast show. Please subscribe, leave us a review, send us a DM, follow along wherever you listen to your podcasts.